Backed it, and by a thumping majority, 524 to 16. There were 55 Tory rebels the last time there was a vote on, that was the tier proposals, not a full lockdown. So there's been a tactical move by some of those rebels to stay their hands. Some of them are alarmed by the new variant. Some of them are hopeful about the vaccine. But in that 16, there's some DUP MPs. So a real shrinkage of the number who are voting against, though quite a few Tory rebels did abstain. There was a routine that we observed today between Boris Johnson and his rebels, where he says to them, I feel your pain, I hate this as much as you do. And the normal part of that routine is he then goes on to say, but don't worry, these rules won't be around for long. There was less of that tonight. And I think that's left a lot of them scratching their heads. On a call with 200 plus Tory MPs yesterday, Boris Johnson was asked, why are these laws carrying on till the 31st of March? And he sort of scratched his head in that way he does, and suggested that he was a bit surprised by that date. Some of them are wondering whether that date actually means a lot, and means a lot more perhaps than the middle of February date for the end of these tightest of these strictures that has been talked about until now.
Gary, thanks very much. Well, one MP who made an impassioned speech in the Commons earlier about the dangers of a lockdown was Conservative Sir Charles Walker. He said people's mental health had already been harmed by earlier lockdowns, and another one would be very hard to endure, especially during dark and cold winter months. Sir Charles joins us now from Parliament. So, Charles, I'll come back to the mental health aspects of all of this in a minute. But if you just look at those figures, 1,041 more COVID deaths, 30,000 people in hospital, yet you voted against measures which would undoubtedly save lives. It's quite hard to justify, isn't it?
Well, no, I voted against these measures because politicians on both sides of the House, Conservative ministers and Labour shadow ministers, keep talking about we've asked the British public. The British public have never been asked. They've been coerced through law to stop seeing the people that they love. Now, if we asked the British public and trusted them to make the right decisions, I think we would be surprised. I wouldn't be surprised, but I think many of those people who feel that they need to be instructed in law would be surprised to see how responsibly they would act. And you saw the usual talk today about people's mental health from the two front benches. I'm afraid I just don't buy into that. It's thrown in there as a sort of, well, it's thrown in there, I think, almost as a sop, but I think people's mental health has been relegated to right back where it was perhaps a decade ago.
You talked in the Commons about how, in your view, people are going to break during this lockdown. What do you mean by that?
Because I do work in mental health. I've campaigned in the area of mental health, and people from around the country write to me with their experiences, and I'm aware that there are people who have committed suicide because their families have told me. People tell me about their own experience. They have already quite small worlds, and when you go into a forced lockdown, their world gets smaller. And this is really, really difficult for a lot of people. And I have just felt for a long time there has been such a lack of compassion to the plight of people who are far less fortunate than myself, or dare I say journalists living in nice houses, who have a small world, perhaps small accommodation, lots of pressures, and this is really tough for them. And I don't think we've ever acknowledged as a political class, a media class, how hard it is for some people. And then we denounce people as being COVIDiots, for example, when they make a mistake or it gets too much for them. I think it's very unfair, and it shows a deep lack of compassion.
It's really hard, isn't it, though, to weigh those very legitimate concerns you have about people's mental health with what you're seeing in hospitals at the moment, and people within the NHS saying that they just will simply collapse if they don't have this new lockdown. Did that make you think twice before voting the way you did?
And I get contacted by mental health professionals. They're not a uniform group, but I get contacted by a number of mental health professionals who are deeply concerned as to what's going to happen to their patient cohorts. So again, yes, physical health is important, but we talk about parity of mental health, and it just doesn't seem to be there. It doesn't even seem to be discussed in a meaningful, sensible way, and that's just not acceptable. Now, only 16 of us voted against the regulations today for a variety of reasons. One of them that they weren't going to be reviewed till March 31st. But look, people out in the audience can hate what I'm doing, but actually I'm in that division lobby for those people who haven't got a voice, who feel that this lockdown is more than they can bear. And in a democracy, things have to be contested. And those who love the lockdown, the 78%, or endure it, or can get on with it, well, they have all the voices in Parliament, or almost all the voices. There need to be a few voices for those who are struggling with this, either through their deteriorating mental health, the fact that they're losing businesses, possibly their homes. And so let's just be a little bit, let's just be sensitive to the idea that there are people out there who don't all think the same.
Sir Charles Walker, thanks very much for joining us. Matt.
Thanks, Kathy. Well, in Wales, more than a third of hospital beds are now occupied by patients with COVID-19. The chief executive of the Welsh NHS today warned that it faces a difficult period ahead. Our Home Affairs correspondent Andy Davis is in Cardiff for us tonight. Andy.
Matt, we've had a full national lockdown in Wales now since the 20th of December. There have been some notable dips in the 7-day case rate in Wales, which incidentally is now below that of England and Northern Ireland. But because it coincided with far fewer tests being carried out over the Christmas period, it makes trying to sort of map a true direction of travel accurately somewhat tricky. But the situation regarding hospitals in Wales is less confusing, and it's not good. The head of the Welsh NHS today said that there now are almost 2,800 patients with COVID in hospitals in Wales, and that's 4% up on last week, and a record number. And if that trend were to continue, he said today, then the number of COVID patients in Wales in these hospitals could very soon be twice the amount witnessed at the height of the first wave last April.
And Andy, tell us about the state of intensive care units in Wales.
Still under phenomenal pressure, 140 COVID patients in critical care units in Wales. That's the highest number in this second wave. And a couple of hours ago, I got in touch with a member of staff in a South Wales intensive care unit and asked them to sum up the mood there. And they replied with this: "We're anxious and scared that we can't look after people coming into the hospitals in the way that we want and know that we should be. We're trying to nurse each other through to the end of each shift. I genuinely worry about what this is doing to my colleagues and friends. People are leaving, and I don't know how many we will have left by the time this is settling." And finally, another terribly sad milestone. Public Health Wales today reported 76 COVID deaths. That's not over a single 24-hour period, but in the context of the way that they report COVID deaths, it represents the highest daily total in Wales since the start of the pandemic.
Andy Davis, thanks very much. Well, I'm joined now by Dr. Margaret Harris, spokesperson for the World Health Organization in Geneva. Thank you for coming back on the programme, Dr. Harris. When you listen to this litany of really terrible numbers, especially here in Britain today, more than 1,000 deaths, really the worst daily death number since the beginning of the pandemic, what is your reaction?
Good evening, Matt. My reaction really is my heart goes out to everybody who is losing their loved ones, and also to all the healthcare workers who are working so hard day after day after day. The worst thing that can happen as a healthcare worker is to fight for a life and see that life lost.
And when you look at the global numbers, we're getting close to 2 million deaths as a result of this pandemic. Is there much worse to come, or do you see a light at the end of this tunnel?
I do actually see a light at the end of this tunnel, it sounds almost ridiculous when you've just heard about all the struggles people are facing in the United Kingdom, but we are seeing the vaccine rolled out. What we have to do, though, that vaccine is not going to save lives today. It's not going to save lives next week. It's going to save lives in the future, which will be great. But right now, the people who will save lives are the people who are taking all the actions to prevent transmission. Okay. Those are the ones who are doing all the things we ask them to do.
Very specifically, in this country, we've decided to give the first dose, rather to delay the second dose of the Pfizer vaccine from 21 days, to 3 months. Do you approve of that delay for the second dose or not?
So, as you know, that our strategic advisory group of experts, which is a bit confusing because you've got one too, but they are experts on vaccines from around the world that come and advise us on use of every vaccine. And as each of these vaccines are rolled out, they're coming, as they're given a emergency use listing by WHO, they're coming and providing global recommendations. Now, they looked at the data on the Pfizer-BioNTech, and they decided that they could not recommend it, the second dose, for longer than 21 to 28 days because that's what the data, that was the only data we have.
Right.
So scientifically, they couldn't go beyond that.
Okay, so you differ from the British scientific view on this. We're parting company on this one.
Well, that's really a policy issue. So the next sort of part two of what I was going to say is that we do leave it to the local regulatory bodies, to the national bodies, because they know their community, they know their epidemic, and they make those decisions in terms of what's actually going on in their communities.
Briefly and finally, WHO officials trying to investigate the origins of the pandemic in China have been turned back by the Chinese authorities. Your response to that, briefly?
Well, certainly we're very anxious to get on with this. This is something that the world has asked we find out, and we need to know this in order to prepare, not just to understand this outbreak, but the next one.